Have you ever found that alternative medicines are not enough and you're still sick? I'd like to address this question as part of my Common Sense Lyme disease series, where I take what I've seen in my practice, what I've read from the literature, and address different issues that come up in my practice. So let's begin. I had a patient who tried different things, everything you could think of: strict diets, exercise, integrative medicine, massage therapy, yoga, even hot yoga, but it just couldn't manage her Lyme disease symptoms. They have helped temporarily, but none of them resolved her illness. She still remained chronically ill. A turning point is she was introduced to the possibility that she may have a persistent tick-borne infection. So instead of assuming it's a syndrome, that's post-treatment Lyme disease syndrome, that you'd have to live with it, that you'd have to take alternative medicine as a sole approach, she looked back again and realized that there may be a persistent tick-borne infection. We ended up using a lower dose than she had in the past. We used straight therapy instead of pulse therapy, and we were able to gradually find an antibiotic that she could tolerate. Her symptoms eased at first. For the first time, she felt better, and she was on a road to recovery. So the takeaway is that sometimes, despite taking alternative medicine approaches, going back to a persistent tick-borne infection, treating a tick-borne infection is helpful, and that's what happened with my patient. Thank you for joining me for this Common Sense Lyme disease program from my practice. And if you have any comments or questions, leave them below, and I'll try to address what I can. Thank you for joining me.